and welcome to my channel. This is Pritesh Yadav and today we shall be discussing an important clinical symptom known as cyanosis. So without wasting further time, let's get started. Firstly, with the definition. Cyanosis is defined as a bluish discoloration of the skin and/or mucous membrane, and it is usually due to an elevated quantity of reduced hemoglobin of more than 4 grams per deciliter in the capillary venous blood. Findings are most apparent in the lips, nail beds, ears and the malar eminences. Now, let's look at how to approach a patient of cyanosis. Firstly, inquire about the duration, like if the cyanosis is from birth, it suggests a congenital heart disease, or it can be due to an exposure, like from drugs or chemicals that can cause an abnormal hemoglobin. Differentiate central from peripheral cyanosis by examining the nail beds, lips and the mucous membrane. Peripheral cyanosis is most intense in the nail beds and may resolve by gently warming the extremities. Then you can often check for clubbing, that is a selective enlargement of the distal segments of the fingers and toes due to a proliferation of the underlying connective tissue. Clubbing, which may be hereditary, idiopathic or acquired, and it can be associated with other conditions like lung cancer, infective endocarditis, bronchiectasis or hepatic cirrhosis. A combination of clubbing and cyanosis is frequently seen in congenital heart diseases and is occasionally seen in pulmonary diseases like a lung abscess, a pulmonary arteriovenous shunt and with uncomplicated obstructive lung diseases as well. Then you should examine the chest for evidences of pulmonary diseases, pulmonary edema or a murmur which can suggest a congenital heart disease. If the cyanosis is located in the extremities, evaluate for peripheral vascular obstructions in such patients. Obtain an arterial blood gas to measure the systemic O2 saturation. Repeat while the patient inhales 100% of oxygen. If the saturation fails to increase to more than 95%, intravascular shunting of blood bypassing the lung is likely, that is, a right to left intracardiac shunt. Also, evaluate for abnormal hemoglobins like hemoglobin electrophoresis, spectroscopy, measurement of methemoglobinemia as well. If you found this video informative, please consider liking and subscribing to my channel for further videos like this. Thank you very much.